Hello, you guys. Welcome to the Doula Dive. I am so excited to be chatting with you all today. In one of my most recent videos, I talked about changing positions during labor, how frequently you should be doing that, different positions you can get into, how you can change those positions subtly. And today we are going to be moving on to talk about changing positions during that final pushing stage of labor. So hopefully you guys can walk away today feeling confident, feeling ready to change positions during labor and bring that beautiful baby out into the world. So often when we are seeing women give birth on TV, in movies, etc., we are watching them deliver a baby laying on their back in the hospital bed. And to be completely honest, this is probably the worst position you can deliver a baby in because you are not using gravity to help you and you also don't have very much power in this position laying on your back. Just like we talked about in the changing positions during labor video, during the pushing stage of labor, you also want to be trying to change positions every 5 to 6 contractions. This is going to help baby rotate, descend into the canal. Studies have shown that changing positions frequently like this can help lead to shorter delivery times, can help decrease your risk of needing forceps or a vacuum, and also can help to decrease your chances of having a cesarean. So similar to changing positions during labor, you want to think about positions where you are utilizing gravity to help you, such as squatting. You can have them put a squat bar on your hospital bed so that you can get some leverage there when you are squatting down. You can also get into an all fours position. That's also going to allow gravity to help you and is going to help create space for baby to be able to rotate and descend down into the birth canal. Other great positions for pushing are side lying, which is an amazing position for women that choose to get an epidural, as well as a closed knee position, which you can do in a side lying position, you can do on all fours, you can even do this on your back. The closed knee position is going to help widen your pelvis, open up that pelvic outlet, and can be a great addition to your movement during the pushing stage. Remember that just as with labor, if you do choose to get that epidural, you still want to be continuously moving and changing positions during that pushing stage. So having somebody help you get into different positions so that you can continuously move is going to be so beneficial to you. A couple of things to keep in mind are to really try to relax and breathe deeply in between those contractions when you are getting rest in between those pushes, and to also make sure you're finding positions that you feel comfortable and powerful in. Having open conversations with your provider prior to going into labor is going to be so beneficial so that you know their comfort level with certain pushing positions and you can decide if that's the right provider for you or if you maybe need to go find somebody that's more comfortable with positions that you see yourself being able to push in. Having these conversations is also going to be so important so that you know what they have available at the hospital as far as pushing goes, such as a squat bar, and if they have mirrors available, if that's something that you choose to do so that you can get feedback while you are pushing. You can also find out what things they offer as far as helping you to prevent tearing, such as if your provider is able to provide warm compress on your perineum while you are pushing. I am going to do a whole video on reducing your risk of tearing and what the research says, so stay tuned for that coming up. If you want to know more about different positions you can get into when pushing or anything else having to do with labor and pushing, changing positions, please reach out to me. You can reach out on my website, katepangos.com, or on Instagram at katepangos. I would love to chat with you all about what I offer as a virtual doula, as well as my perinatal Pilates packages. Thank you all so much for joining today. I hope you have a wonderful rest of your day, and I will see you in the next video.